Hello everybody, I am Dr. Lucas, consultant OBGYN and lead of my hospital's national COVID-19 immunization program. Many parents, like myself, have genuine concerns about the safety first and foremost, and of course the efficacy of the pfizer Comirnaty COVID-19 vaccinations for our younger children. So I will share with you some facts that I have about the vaccine for our younger children, and I hope that this will help answer most of your questions and help you decide whether or not to have your child vaccinated. And if you're undecided, you're not alone. In a survey done by the KFF COVID-19 Vaccine Monitor in the United States last December, opinion was split across the board. So there are some parents who are very keen. They've made up their mind from day one. Once my child is eligible for the vaccine, I'll have him or her vaccinated because I believe that the science is sound and this is the best protection against COVID. There are others on the other end of the spectrum who have decided as well not to vaccinate their children because they're just not comfortable enough with the vaccine, or they don't think it's going to be necessary. There are many parents who are still thinking whether or not to have their children vaccinated. They would like to have more data, more evidence, and I hope that through the over the next few minutes, as I present more information, the parents, especially those who are undecided, will be able to come to a more firm decision on whether or not to vaccinate your child. Are COVID-19 vaccines safe? This is the most important question that we have. As medical professionals, first and foremost, we want to ensure that any intervention we mete out is safe. And then, of course, is it necessary? Is it effective? So there are two main reasons why we believe that the Pfizer Comirnaty vaccine will be very safe for children. First of all, the dosage given is 1/3 that given to individuals above the age of 12. So with a smaller dose, logically, the side effects experienced will be a lot less. Secondly, the time interval between the first and second doses in younger children is 8 weeks, instead of the 3 weeks that individuals aged 12 and above were advised to undergo. Also, there is real-life data now. More than 10 million children have been vaccinated, and a very, very small proportion have severe adverse reactions. Most adverse reactions are quite mild, and the children are able to tolerate them quite well. And these reactions do go away within a few days. Clinical trials and real-life data, they also show that these vaccines are very effective against the pandemic. They prevent severe COVID-19 symptoms, prevent the onset of MIS-C, Multisystem Inflammatory Syndrome, which I will elaborate on later, as well as the risk of the child developing long COVID in future. So, most healthcare professionals, in fact, more than 95% of healthcare professionals polled in the United States did agree that they do believe vaccinations against COVID-19 is the best way for us to tackle this pandemic. Adverse events within 7 days of COVID-19 vaccination. So local side effects like pain, redness, and swelling, these are quite inevitable, even with a lower dosage. And more than 70% of children do complain of some pain at the injection site. So pain is quite unavoidable. But for most children, a simple dose of paracetamol or Panadol will help to greatly relieve the pain. Some children are going to experience fever, fatigue, headache, muscle pain, chills. If it's something that a dose of Panadol is not able to help with, or the symptoms persist, or if children develop chest pain, shortness of breath, or they're just generally very unwell, seek medical attention immediately. Most side effects are quite readily treatable, and very few children actually have severe complications from the vaccine, as I will share later. And there is no need to take time off school. Children being children, unless they are really quite ill from the vaccine, they're able to go to school, play with their children, their friends, I mean, and we don't have to be too concerned. As long as they have been informed, especially the older kids, let them know that should they feel unwell, let their teachers, supervisors, or guardians know immediately. So out of more than 8 million children or 8 million doses of vaccines given in the United States as of December 19, 2021, only about 4,200 actually reported any adverse events at all. And only 100 out of more than 8 million doses given reported serious adverse events. And some of the serious adverse events were actually high-grade fever or vomiting that required treatment in a hospital setting. What I believe most parents are concerned about is the risk of myocarditis or heart inflammation. And thankfully, only 12 children out of more than 8 million doses administered were found to have confirmed myocarditis. So that comes to about 1.5 children out of 1 million. The risk of getting this myocarditis is really quite low, and it is a few hundred-fold less than if you were to get COVID-19, leading to the possible complication of myocarditis. And I'll share this in a slide later. Most of the side effects or adverse events reported were really very mild: fever, headache, dizziness, vomiting. You will see also with some concern that quite a number of the adverse events reported were actually issues with dosage. So if you are concerned, the dosage for children again is 10 micrograms. Check with the healthcare personnel administering the dose for your child that it is 10 micrograms and amounting to 0.2 milliliters in a syringe. So again, 10 micrograms in 0.2 milliliters of vaccine. This is the dosage that should be administered for children between the ages of 5 to 11. And this slide, as I mentioned earlier, only 12 cases of myocarditis were confirmed out of more than 8 million doses administered as of December last year. And why did we decide on having the interval increased to 8 weeks between the first and second dose? Because we see that on the left, an interval of 3 weeks after the second dose, the antibody response actually does increase to a very good level. However, if you compare that to a longer dosage, the antibodies generated can actually be higher, and they also last for a longer period of time. So it will be more efficacious. And moreover, you don't have to suffer, or it reduces the risks rather of severe adverse events because there's a longer time interval between the two jabs, and the immune response mounted will not be as severe. So you will have good levels of antibodies and likely less severe reactions. So the graphs on the left and the right, they distinguish the response for the intervals of 3 weeks versus 10 weeks. And also top and bottom graphs. The top graphs with the in gray, that represents people who are COVID naive. They have never been infected with the COVID-19 vaccine before. Graph below in red are the depict people who have previously been infected. So I get many questions from parents asking, if my child has had the COVID vaccine, COVID infection before, does he or she still need to be vaccinated? Yes. Why? Because getting the infection is akin to your first dose of vaccine. So as opposed to those who have never gotten COVID before, they start with 0 antibodies. If you have had COVID before, you do have some background antibodies. However, after your first dose, it just goes up a little, and only the second dose will act like a booster to give it sufficient antibodies that we believe is effective. And although some would argue, even after the first dose of vaccine, the antibodies mounted seem to be quite significant already. Do we really need to have a second dose? The short answer at the moment is yes, because we don't know what kind of background antibody levels someone with COVID infection will have. With the vaccine, it's very standard. You get a standard 10 microgram dose. Most children between the age of 5 to 11 will have a standard immune response to that. For those who have had COVID infection, we don't know if they're going to generate sufficient antibodies after the infection. Some could start off a lot lower, a lot closer to zero. So the first shot might not actually yield that much antibodies production, and they do need the second shot before they can achieve an efficacious level of antibodies in their bloodstream or in their bodies to combat the COVID-19 infection. And having a second dose is quite safe. It doesn't cause the antibody levels to really go sky high. If the antibody levels to begin with are quite high already after the first shot, the second dose just helps to have the antibodies sustained at a peak level for a longer period of time. So in short, whether or not you have had COVID-19 infection, the child will be advised to have 2 doses of the COVID-19 or Comirnaty vaccine. This slide shows myocarditis risks for children who undergo vaccination versus children who have been infected by COVID-19 infection. Children with COVID-19 infection are at an increased risk of getting myocarditis or heart inflammation. 450 children in a million, in fact, do end up having myocarditis, whereas with the COVID-19 vaccine I mentioned earlier on, it's about 1.5 or 1 in 1 million doses, 450 times difference. And heart inflammation is just one severe adverse event reported. There are many other complications of COVID-19 infection that can affect children. The risk of MIS-C that I will explain later on, Multisystem Inflammatory Syndrome in children, 1 in 1,000 of those infected will develop this between 2 to 6 weeks after the onset of first infection. So they can seem quite well for the first 1 or 2 weeks, and then later on they develop this severe immune response. They get rashes, diarrhea, tummy pains, they get very unwell. And not only that, after recovering from COVID, some children do have long-lasting effects just like adults, and this is what we know as long COVID. With vaccines, just like all the other vaccines we've had since the time we were born, side effects are usually temporary and they are self-limiting within a week or 2. It is very unlikely that the COVID-19 vaccine, whether it's the inactivated or mRNA vaccine, will result in long-term side effects or complications. Remind your children, if they do feel unwell at any time after the vaccination, inform their teachers or supervisors if they are in school, inform an adult or even their siblings if they are at home. Seek medical attention immediately, do not wait. Some adverse events can be quite severe if not dealt with immediately. So MIS-C, as I mentioned, this is something that children develop between 2 to 6 weeks after the initial COVID-19 infection. Fever, stomach pains, diarrhea, vomiting, rashes, bloodshot eyes, dizziness, lightheadedness, amongst many other more severe symptoms. And COVID continues to torment us. This is live data from Malaysia. we have about 80% of adults who have been, or 80% of the population rather, who have been either fully vaccinated or even boosted already. And yet, the 20% who have not been vaccinated make up the majority of deaths. So it goes to show vaccination is very, very effective. Again, a vast majority of doctors and scientists do agree COVID-19 vaccinations offer us the best protection against the current pandemic. The current Omicron strain seems to be quite rampant in young children. We see the cases increase in children. In fact, in Singapore, it was reported last month that the 5 to 12-year-old age group made up the most number of infections by age category. And in Malaysia, the death rates have increased also amongst young children. In the whole of 2019, there were only 10 children who died from COVID-19. In the last 6 months alone, 26 children have already succumbed to COVID-19. And as I mentioned earlier on, even those who survive, they could have long-lasting complications later on. Long COVID. The Comirnaty vaccine is the only one approved at the moment. Many parents are asking me if Sinovac is approved. There are many trials underway. We should have some data published by April, hopefully, and that could perhaps be another option or arsenal in our works to be vaccinated or immunized against COVID-19. But until then, in this interim period, COVID-19 vaccination in Malaysia, only Comirnaty Pfizer vaccine is approved by our Drug Control Authority for children aged 5 to 12 years old. Can my children or child have COVID-19 vaccination if they've been previously diagnosed with MIS-C, if they had previous COVID-19 infection, or they have allergies or medical conditions? So if they have been diagnosed with severe forms of COVID, they had to be fully recovered and more than 90 days from diagnosis before they can have the vaccination. Otherwise, we are concerned, especially with MIS-C, they will have too strong an immune response and suffer from the complications of the vaccination. After 90 days, it should be quite safe. Previous COVID infection, as I mentioned before, it is recommended for these children to be vaccinated. How soon can they be vaccinated? After 10 days from initial diagnosis, which is actually just the quarantine period. So if someone was diagnosed with, or a child is diagnosed with COVID-19 today, then in 10 days time, once they have completed their 10 days of quarantine, as long as they're asymptomatic on day 11, they can go for their COVID-19 vaccination. If you're concerned that your child has allergies and medical conditions, at the moment, there are almost no contraindications for most medical conditions or allergies to like seafood, painkillers, or even other types of vaccine, because the makeup in the Comirnaty Pfizer vaccine is quite different from other medications and food products. But having said that, if you have any concerns at all, please bring it up to your healthcare personnel in charge that day. All vaccination centers in Malaysia or vaccination sites in center will be monitored by doctors on site. So if you have any allergies or your child has any allergies or medical conditions, please state this clearly and inform or ask to speak to the doctor on site. In summary, expert advice on childhood vaccinations, this is recommended. Most healthcare professionals do believe that vaccinations are the best way to protect ourselves against the COVID-19 infection. Heart inflammation risk is very low compared to if you were to contract COVID. Side effects are usually mild and temporary. Long-term side effects are very unlikely, and there's a lot of real-world data to show that the COVID-19 vaccines or Pfizer Comirnaty vaccines are very safe and efficacious in both reducing the risk of severe COVID as well as reducing the risk of long COVID. So again, in all age groups, it shows that in the younger age groups, infection rates are starting to rise, just like all the other groups. But in the younger age groups, larger proportion of them are actually getting sick. We are hearing a lot in the newspapers and radio stations nowadays, where there are clusters developing in schools. We're sending our children to large social settings without any antibodies against a very rampant Omicron variant at the moment. So for that reason, I do think our children need protection, and the vaccine is the only way they can get sufficient antibodies in a safe way. There are some parents who are waiting for the Sinovac vaccine to be ready. We don't know when that will be. Hopefully in the next couple of months, but our cases are continuing to rise by the day. So it might be safer to consider taking whatever vaccine is available, and at that moment, that is the Pfizer vaccine. With that, thank you for listening to the end. If you have any queries, feel free to email me, and we can perhaps have a chat. Okay, I do hope that this has clarified some of your doubts and queries regarding the COVID-19 vaccination program in Malaysia, and I hope that we will be able to do the best or make the best decision we can for ourselves and our children during this COVID-19 pandemic. Lindungi diri, lindungi semua. Take care, stay safe, God bless.